Hello, my name is Damian Blum, and I want to talk about the thief in the house. By thief in the house, I'm referring to oxygen deprivation. The way the thief gets in the house is by an airway obstruction. And this we see when we look in the mouth. So our goal is going to be to make sure that that thief doesn't get into our house. Get rid of the thief. So open the airway. Now in children, it is a big deal because this starts from the time they're born. If you have the little kid stick their tongue out and you see that there's a lingual frenum that doesn't allow the child to move the tongue normally, that's a big problem. As you develop, when you swallow, the tongue goes up to the high palate. So as the tongue presses against the palate starts to expand. And as the palate expands, so do the dental arches. This means that the tongue now has room to sit between the teeth. If there is no such room, the tongue sits up high above the teeth and eventually starts to block the airway. And as it blocks the airway, the kid's not getting proper oxygen. Then you need to pull the tongue down and look at the tonsils, see if that airway is obstructed. We know that the airway obstruction will create a lot of problems with attention deficit hyperactive disorder. So what we want to do with these children is if there is a lingual frenum that is keeping the tongue from moving, you need to snip that, whether it's a laser or whichever way. And if you don't do it, refer to somebody that does. If the tonsils are a problem, you need to get rid of the tonsils. You need to get rid of the adenoids. And if you have narrow arches, you need to make sure you go through palatal expansion.